I'm Sherry Boschert reporting for IMNG Medical Media at the annual meeting of the American Psychiatric Association. A survey of 275 psychiatrists, primary care physicians, and nurses found that they all treated patients' physical problems differently depending on whether or not the patient had schizophrenia.
We conducted this study to find out if the providers in the VA, both the mental health and primary care providers, treat the patients who have schizophrenia any differently than those who do not. So to answer that question, we developed a vignette-based study and created two vignettes. One had, the vignettes were identical in every aspect except that one vignette had a history of stable schizophrenia and the other one did not. The history was 34-year-old male with hypertension, obesity, insomnia, and chronic back pain. The patient was returning for follow-up and seeking stronger pain medications. He was on naproxen and fluoxetine, did not have any substance abuse, was working in a cafeteria at the VA and attended church, enjoyed fishing and reading magazines like any one of us. So we gave these two vignettes to providers in the 5 VA medical centers, and each respondent answered one of these two vignettes. What we were interested in knowing is, did the providers refer this patient to obesity clinic or weight management because this patient was obese? Did they refer him to sleep study because he was not sleeping well, or pain management program because he had back pain? We also wanted to know if the providers would, what their expectations were from this patient in terms of its patient's function, their competence, and ability to adhere to medication. So this is what we found. On the outcome, whether the providers consider the patient with schizophrenia to be adherent to medications, all providers expected the patient with schizophrenia to have lower adherence, while we know from the data that non-adherence rates for any chronic mental illness are very similar to patients who have schizophrenia. And we did not find any difference between mental health and primary care providers. We all treated the patient the same way, meaning they were less adherent. Same story in terms of referring this obese patient to weight management program. Patient with schizophrenia would be referred less to the weight management program, whereas we know from data that these patients are equally likely to benefit from weight reduction programs. Providers expected the patient with schizophrenia to have lower functioning, social functioning, whereas we know from the data that only 25% of the patients with schizophrenia have poor outcomes and lower function. 75% do as well as others. So in terms of competence to make decisions, treatment decisions, and financial decisions, we know from the data that persons with schizophrenia are likely to have adequate decision-making capacity unless they're psychotic, but all the providers expected this patient who had schizophrenia not to be competent to make decisions compared to a person who did not have schizophrenia. So the study results suggest that there's a need for addressing bias amongst all providers. We had expected initially that primary care providers would have more bias, negative bias, but we didn't find any difference between primary care and mental health. So mental health professionals were as much guilty as our colleagues in primary care. Thank you.
Now, we use the word stigma, and I think that really is an understatement. I think it's prejudice. And in our society, fortunately, we don't allow prejudice anymore based on a variety of factors. But we still, to whatever degree, tolerate prejudice when it comes to people who have psychiatric conditions. And that's something that we really need to change. So studies such as this can help impact that.